So welcome, Alice.
Perfect. All right, thank you, Helen. Thank you, everybody, for coming. I've learned so much and have met so many people these past 2 days. It's been overwhelming and enlightening. I don't know if it's a good thing or a bad thing that Helen put me last this morning, because maybe it's good, everyone's still asleep and won't care what I say, or she knows that I keep my slides super simple and sweet and get to the point, or else I could talk all day about what I do. So as she said, my name is Alice Valenta. I'm a public health dental hygiene practitioner. Everyone loves that long acronym for PHDHP. And I am the owner and operator of Golden On-Site Dental. So a little background about myself. I'm a graduate from the University of Pittsburgh Dental Hygiene Program. I received my PHDHP in 2014. I was one of those hygienists that was getting burnt out. I am not a clinical practicer that loves being in the box of the traditional office setting. So when the PHDHP came out, I jumped on it. At first, I started out in nursing homes, which I absolutely loved, but sometimes the drives and taking the equipment in and out was a little wearing. And then eventually I got into pediatrics. After COVID, I took the chance and jumped in head first and started Golden On-Site Dental. It's overwhelming to start your own business. I look at these bigger companies and the great impact you do. It's just me. I am a small fish in that big pond, but I want to make a ripple and help PHDHPs do what I do and help the rural communities. Sorry, I'm very passionate about my business, what I do. Just like Dean Oakley, I am that rural girl, then I married a Pittsburgher and I'm stuck in the city. But my heart is still in those rural areas. So I'm like, how do we get there? But now I do kind of love the city and the convenience, so I'm not one to move back out there and stay. So what I did was mobile. So first I identified those with lack of access to care. The children and adults with disabilities, the seniors within the nursing homes, low-income families, and families with no transportation. As many of you that have spoke have touched on a lot of these areas, and I love how you're working together to get out to these communities. So what we can do as dental community, go into the schools, as we just heard, but I love how you say it, break down those barriers of the PHDHP. There are ways on kind of to work around it because of those lovely gray areas of the ADA, and but there's so many ways we can get in there and make it simple if we break down those barriers for us PHDHPs. Nursing homes, which we reach into, community centers. So I find these areas of low-income families, and I can go into the community centers to help provide dental care. And I do all ages, because I'm a glutton for punishment. I started out doing pediatrics again, but as I was seeing the kids, the parents would go, what about me? Where can I go? And I'm like, sure, I can see you too, why not? So it actually made it easier too to get patients to show up because they're all being seen. They can be a family. I have 3 kids. If I can schedule for all 3 of them to be seen at once, I'm gonna do it. If I have to take one to one place and then schedule to go to another place, odds are I'm gonna find another place to go. And WIC offices. We keep hearing about maternal, and this has been one of my favorite collaborations. I love going into the WIC facilities because my husband's like, what does dental have to do with WIC and prenatal care? I'm like, everything. Not only helping those parents and educating them and teaching them how to care for themselves and their babies, but there's a lot also that has to do with if the child has tongue tie, has all these oral things that, yeah, they might not have teeth, but there's a lot more that we can do as a dental provider. So I found ways to bring the office to these facilities. I have portable equipment. I started out with just my regular van, loading up my compressor unit, my Profi angle, and then I eventually got my radiology equipment. And now I have my lovely van that I have pictures of. It's equipped with a dental chair and a compressor inside it. So now I can pull up to these community centers and save my back in the long run of loading and unloading the stuff. So this is another one of my favorite places that I go to, is the ARC facility. Again, patients with disabilities. This going into their facility here, not only are they able to get different resources that the ARC provides for them, but also they're more comfortable. Yes, we came from a dental office, but these patients, when they go into a dental office and you lay them back in that dental chair, put that bright light in their face, they get anxious. So I found different ways to come to them, make them more comfortable. This facility is very great with anyone with disabilities if they have any diagnosis, and I found it's a lot more calming, so they're more likely to let me in that mouth so I can take a look. And this is my lovely blue van. I was fortunate enough to marry a very handy gentleman, so my husband's electrician, he put my HVAC system on there. It's equipped with solar panels, and it runs off an electric generator. So I work a lot with the Caramobile, and I tease them all the time because they have to get gas for that generator. I'm like, I can go anywhere. But in Pittsburgh, it is pretty cloudy, so we have to make sure I have a sun. And I'm flexible. Flexibility is a big key in public health. So the one day before my HVAC, I worked outside. You come to the community, you do what you have to do to make it work. And my fun trick or treat, the one time I was a scary dental van. So like everyone else here has said, collaborate. And I love all the people and friends and connections that I've made these past 2 days. So not only collaborating with the ARC facilities, with WIC offices, Head Starts is a big one, getting into those schools, seeing those kids in the Head Starts before they're even school age, and working alongside with the MCOs. Working with those MCOs, we really need to break down these barriers for all dental professionals, especially PhDs. I love the programs that these universities are instilling to get out in the rural areas, but mobile dentistry is a big key factor. I've been to national conferences, I've spoken at a few of them, and seeing what other states are doing in the mobile unit, we need to bring that in Pennsylvania. It's gonna be big. Teledentistry is here to stay after COVID, and using the mobile units is going to get us into these rural facilities. So again, we need to close the gap by working together, bringing the office to them, and also collaborating with offices and providers. So I'm not taking those patients from you, I'm seeing them in the areas that you can't get to, and then I work a lot with other provider offices. So then I can refer them to you for the treatment. I want them to get seen, I want them in the office, but sometimes transportation, their access to get to you is not possible. So we have to work together, everybody, to just close these gaps, get everyone seen, and yeah. So this is my contact information. I could talk all day about what I do. I love what I do. After doing hygiene for over 20 years, I am that hygienist. Like I said, I was getting burnout, but I can finally say I love what I do when I come home. So please feel free to contact me or reach out to me afterwards. Thank you.